Keratoconus is a term that is used for a conical cornea. Kerato means cornea, conus means it becomes conical. That means that the normal spherical shape of the cornea, it is becoming irregular and it is tending to protrude out. Patients who have recurrent allergies and they are rubbing the eyes recurrently or very vigorously may have an early onset of keratoconus. The front part of the eye, that is the cornea, which is one of the major refracting surface of the eye, becomes irregular. If you are having a suspicion of keratoconus, if there is a family history, or if there is recurrent change of glasses, specifically progression of glasses, more so changes in the cylindrical power of your glasses, then you should suspect keratoconus. Diagnosis of keratoconus can be made by a very simple test which is called as topography. Topography is the measurement of the topography of the cornea, and the commonest test that you do is called as Pentacam, where you can measure the front surface of the cornea, the back surface of the cornea, and the thickness of the cornea. So there are specific features of cornea being steeper, cornea being irregular, height deviation between the front and the back, height deviation between the steepest and the flattest part of the cornea, which can easily be seen in this simple diagnostic test which is there. If caught early, you should be able to correct the further progression of keratoconus. The normal constant treatment that you have to keep the keratoconus in line is called as corneal cross-linking, or CXL or C3R. In this, you are loading the cornea with a dye called as riboflavin and exposing it to a titrated dose of ultraviolet light. What this ultraviolet light does is that increases the tensile strength of the cornea by binding the collagen fibers within the cornea in a much better manner. So the progress of the keratoconus is something that we can stop by the corneal cross-linking. Patient of keratoconus normally does not get good vision or good quality vision with wearing glasses. What is the reason for that? The cornea which is placed here, the glasses are placed in front of the cornea, the light goes through it, the light going through it can go in a symmetrical fashion, but when it hits the cornea, it again gets distorted. So therefore the glasses not being in contact with the surface of the cornea cannot mask the irregularities of the cornea. So the treatment therefore would be to go in for a rigid contact lens or a gas permeable contact lens or special lenses for keratoconus which are called as Mini-Scleral or Rose-K contact lenses. Keratoconus, if you want to do a surgical cure, the latest is TCAT and TREC, which is with the Amaris system, that you can do the symmetrization of the cornea by removing limited amount of corneal tissue. Along with doing a TREC or a TCAT, you will have to do a corneal cross-linking in these particular cases. A corneal cross-linking will stabilize further progression. So these two modalities will give you excellent outcomes. Otherwise, if you have to reduce the power of the patient, you can also do what is called as intracorneal ring segments. Intracorneal ring segments are like a belt. It is semicircular. You put a ring segment within by making a tunnel in the cornea and putting these plastic segments into the cornea, which give support to the irregular cornea, make it more stable and make it more symmetrical. Keratoconus has several treatment modalities. Please come and get it checked and get it corrected before it becomes to the stage of being irreparable with any of these procedures and needing a corneal graft.
Follow Center for Sight and post your queries to get answers from the experts.